Hi there, and welcome to Healthcare Hour with Colleen Qvist. Another week, another month. Actually, we're tracking a lot through January here. So no matter when you're listening to this, yes, we are nearly halfway through January. So 2026 has started with a bang. People have come back. They are really flying through things. But of course, you may not be listening to the show in January. Yes. What is Healthcare Hour with Colleen Qvist? It's mainly about healthcare professionals. As you know, as a coach, I work with healthcare professionals. It's about us understanding that they're people. They're not just professionals. They're not just robots that we can consult with whenever it suits us. Also, we need to improve the relationship, improve communication between the healthcare professional and the patient. And of course, the patient's family feature a lot in here as well. And then the third aspect, which is really what we're going to be talking a lot about today, is as the public, we need to be educated. We need to be informed. We need to know what's happening. We need to identify signs and symptoms and messages from our body. So after the break, we're going to meet my guest today, who's Renathe van der Merwe. We'll let her say hello now. Hello, Renathe.
Hi, Colleen. Good morning. Thank you so much for the opportunity.
Thank you for joining us. But we need to pay our bills, so let's go for a break. Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Renathe van der Merwe. And as you can see from her cool picture, her cool screensaver, she is from FOST Heroes. So Renathe, welcome again.
Thank you so much, Colleen.
Okay, so before we dive in, let's say, Renathe, I see that you are the senior coordinator for the Angels Initiative in South Africa, and you are also the FOST Heroes National Coordinator for Stroke.
Yes,
And
yes,
that's
that's true.
for this, yes, for the FOST Heroes, which relates to stroke. So,
Yes.
yes, let's ask you briefly, how did you get into this field?
Oh, so I've got a very long journey. I've got a degree in biological sciences and a postgraduate certificate in education. And after my stint in London as a teacher and Pretoria as a biology teacher, I ended up in the pharmaceutical industry. And I was a rep for a company for many years. And that role evolved with me joining the Angels Initiative. So, as the Angels Initiative, their purpose is focusing on improving the acute stroke pathway. So, working with the paramedics, working with the doctors, the nurses, the specialists, so that when the patient gets to the hospital, everybody knows exactly what to do. And that's what I've also done for a couple of years, is working with those hospital teams. And then I was lucky enough that this role has evolved into the me being the coordinator for Fast Heroes, because it doesn't help the hospital being ready to treat the stroke patient, but the community is not aware of what those signs and symptoms are and what to do in that emergency. And that's where Fast Heroes comes in. So I'm very happy that I'm now responsible for rolling this out in schools.
Hey, so it sounds fascinating. Okay, so let's start off with what is a stroke?
So a stroke is I'm going to explain it so in the way that I normally do it when we do the teachers training. So
Yes,
we know
that's
that
what we need to know.
that your blood is almost like rivers in your body carrying the oxygen and the nutrients and the glucose. And sometimes there's a blockage in your brain preventing a specific area of your brain from getting that oxygen and nutrients and glucose. So when that blood flow is stopped in your brain, that is when the stroke occurs. So you get two different types. You get an ischemic stroke, and that's the one that's more prevalent. 80 to 85% of strokes are normally ischemic, and that is when there's a clot causing that blockage so that the blood can't get and reach that specific area in your brain. The other type is the hemorrhagic kind. So hemorrhagic stroke is when there was a tear or a rupture of the vessel and there's bleeding inside or around your brain tissue. So the one is a clot, the other one is a bleed, but both are equally important to treat as quickly as possible. And that's why you often would hear the doctors talk about time is brain, because the longer you wait with both types of strokes, the more damage there will be to the brain, and the longer you wait, the more permanent that damage could become. And that's why quick and swift action is of utmost importance.
Yes. So understanding there as well that, when you talk about time as brain, it's basically time as brain damage. So either
Absolutely.
the clot is staying there and the brain is being, um, it's not getting the blood that it needs. It's not getting that river. Okay. And so
It's
it's
not getting the
dying
food.
without,
Absolutely.
yes. Or the other way is that's bleeding, zoom, 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 off goes the blood out of the brain, and then it's also not getting the nutrients that it needs.
Absolutely.
Yes.
Absolutely. And what we've also found is that in general, the public is not aware. They know a lot more about heart attacks because it's more commonly discussed and shown on television, somebody
Mm.
grabbing a chest or grabbing an arm because of the pain. And then they associate that as being an emergency. I have to phone 911, I have to get to the hospital. But the perception is that with strokes, she was old anyway, it was bound to
Yeah.
happen anyway. They think they have time. And that's really a very big misconception, because you need to get to the hospital. This is an emergency and there is treatment available, which is
Mm.
absolutely great.
And then, of course, there are signs that the person's having a stroke. And so, as
Yes.
soon as we pick up the signs, the faster we pick up the signs and act on it, the more likely we are to help that person's brain.
Absolutely. So the common signs they talk about FAST or be fast. So FAST is the acronym that stands for face, arm, speech, and time. So the face is literally, if you think somebody is having a stroke, you will ask them, please smile for me, because somebody that's having a stroke, the one side of their face will smile, but the other side will just be drooping. That's the F for face. The A for arm is because a stroke patient, they are not able to stretch their arms out in front of them and keep their arms there. The one arm will either droop down or drift down, or you will not even be able to pick up your one arm. And then the S for speech is because of this damage that's happening in your brain. This stroke is affecting your ability to speak properly. So sometimes patients with a stroke will speak like this with a slurred speech. Sometimes they will speak, but the words that are coming out are not making any sense. And then in severe cases, patients can't speak. And then the T for time is knowing that time is of the essence. You have to be quick and phone the ambulance and or get that patient to the emergency department. When I talk about be fast, the B is for your balance, an issue with your balance, and then sometimes the E is for eyes, because there is cases where stroke patients can't see properly, so they've got blurred vision, and that might also be an indication. I just want to mention that it doesn't always mean that every single patient has every single sign and symptom. It might just be one or two of those signs and symptoms, but rather act upon this and get somebody to tell you, oh, but it is not that serious, it's not a stroke,
Yeah.
then thinking it's not, and then it
And
might
it
might have
is.
been a
Yeah.
severe stroke. Absolutely,
Yes.
yes.
Okay. So then FOST heroes are not only FOST, they are also referring to the face, the arm, the speech, and the time. So it just
Absolutely.
happens to be a very good acronym for us. Okay.
Yes.
And so tell us about these FOST heroes. We can see one of them on your side of your screen who's
Yes.
really cute.
So that's Tanya on the side of my screen, but the other characters' names are, we've got Frank, that's the F for face, Frank, Armando, Sophia, and then Timmy and Tanya. So Frank, Armando, and Sophia are retired superheroes. Frank had the superpower of being able to pull funny faces, but now he can't do that because one side of his face is drooping. Armando is the grand hero that used to be very strong and he did weightlifting. But now Armando can't lift his weights anymore because one arm is weak. Sophia is the granny that used to be able to sing songs and tell stories, but now she's not able to do that because her two lips are not working. Her speech is impaired. But Timmy and Tanya are the real heroes because they know what's happening and they also know that 112 is the emergency number to dial. And then 112 in South Africa is like the 911 number in America, but it's also linked to one side of Frank's face that's drooping, one arm of Armando that goes weak, and two lips of Sophia that's not speaking properly. So it's 112. And this program was developed by the University of Macedonia. It is aimed at foundation phase teachers and learners so that they could be educated about what to look out for and what is the number to dial. Because unfortunately, our communities are structured these days that children spend so much time with grandparents, with the lady at aftercare, the neighbor next door. So it's essential that we teach the learners and the children an essential life skill because we don't always, as adults, we don't know these things. But it's important that we educate our children from a very young age so that they feel equipped that in an emergency, such as a stroke, they know exactly what to do and who to phone for help.
Yes, so I'm fascinating that you even have tied up the 112 with the half the face, the one
Yes.
arm and also the two lips. And it's amazing that, even as adults, we can remember it then.
Absolutely. It's supposed to be fun and easy because if you think
Yes.
about the target audience, our foundation phase, they are 5 to 9, 10-year olds. So it's your primary school learners. You're supposed to make it fun and interactive and not supposed to be a heavy topic. It's not supposed to be serious or make them scared or afraid. But what we want to do with the learners is that we want them to feel excited because if a child feels excited about something they've learned at school, we want them to go home and share that knowledge with the family members, with the parents, but especially also with their own grandparents or grand heroes. And we talk about grand heroes because it might be that there's not a biological grandmom or dad around, but it might be that that child has got a special relationship with a neighbor next door. And then they can go and tell them what they've learned at school. And that way, the whole message around stroke awareness could be spread to a larger community.
Okay. So yes, I want to come to a class. I want to like
You're
be
most
involved.
welcome. You're most
But
welcome.
let's go for a break. And when we come back, we're going to hear more about foster heroes. Break time. Welcome back. You are with Healthcare Hour with Colleen Qvist. My guest today is Renathe van der Merwe. She is the Senior Coordinator for the Angels Initiative and also the Foster Heroes National Coordinator in South Africa. And we're talking about stroke awareness. Renata has explained to us what a stroke is, that you get two different types, and it's really about the blood in the brain. The one is ischemic, where there's a clot and the blood is stopped from going into the brain, and so the brain dies because it starts to die. It needs what's in the blood. And then the other one is all about hemorrhaging, where suddenly the brain is bleeding from a certain part. And so there goes all the nutrients. She spoke about the blood being like a river in the body. And what's so important is that we need to recognize the symptoms of a stroke because it's time is of the essence in a stroke. The faster you are, the more likely you are to save the person's brain, where she said, time is brain. So along comes foster heroes, and these are a series of cute characters, okay? And they are there to teach our foundation phase, our 5 to 9 year olds about stroke. Now, I'm sure that many of you are sitting there in your chairs saying, no, 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 why must my 5 to 9 year old find out about a stroke? There's enough in their lives. Why do our 5 to 9 year olds need to know about stroke, Renata?
Colleen, the reality is that we all grew up knowing exactly what the child line number were and what the emergency numbers were. I mean, that was part of what you were taught at school, and we were not scared or afraid. But you remember that 10111 number, and you remembered the child line number, and it was something that we grew up with. But somewhere along the years, it just that message just got diluted, and it's not something that is taught these days any longer. But I want to emphasize that with Fast Heroes, we want to make it fun, and we want to make it really interactive for the children so that they don't feel scared or afraid, but that they can also feel like they're becoming a fast hero, and therefore they can make the difference in saving somebody's life. It's not just the Spider-Mans and the PJ Masks and the other animated characters that they see at school, but that they can also feel like, even though I'm a child, I do know what to do in this emergency. And staying calm and knowing what that conversation is over the phone, that's all part of what is taught in Fast Heroes.
Yes. So you're actually empowering children with
Yes,
information.
yes,
Firstly, for them to go home and share with their loved ones, whether that is mom and dad or auntie or granny or grandpa or whoever it is, or the neighbor or whoever they spend time with.
yes, yes.
And then,
So
yes,
So the program is we what how it works is that, say for example, there's a school that signs up, we would educate the teachers, and then the teachers will continue with the program in their classrooms because they know what time is more convenient for them. So they could either make it as part of their life skills, arts and culture, etc., as there are
yeah.
songs, there's activities. So they can either do it as part of, like I say, their life skills, or they can do it as something separate. But the taking home and the sharing of the knowledge is really essential, because we don't just want clever children, we want clever families as well.
Okay, all right. And also, what you find is that um, a granny, a gogo, is going to be probably more receptive to something that the grandchild has to say, and also like carry your pictures home and put them on the fridge.
Yes,
So
absolutely.
it's sending the information into each home and making sure that it gets put on the fridge.
That's what we want. We want them to put it on the fridge. We want them to tell Google what they've learned, because it might mean that nobody has ever taught Google that before. We cannot assume that people have this knowledge, or that they've been exposed to this kind of information before. And that's why it's important to do that now, and to create a new generation of fast heroes that can make the difference.
Okay. And then, of course, the second part is that because children spend time with grannies, we've also got to understand that stroke is not, oh, well, she was 99 and she had a stroke, and oh, well, that's it. Okay.
Yes.
Stroke can impact anyone at any age.
Anyone at any age. I really want to emphasize that it's not specifically just to old and the elderly. It's not just to a specific gender. It can happen to anybody at any age. Even from a child's age, from babies. And yes, that is the exception, but it does happen. And therefore, we cannot say it's she was old, it was bound to happen anyway. It can happen to anybody. Even in the schools that I've worked at, I've recently, at the end of last year, I went to a specific school in Johannesburg, and the teacher said in their class, in one of those foundation phase classes, there was a child whose dad already had 3 strokes. So it's
Yes.
not just necessarily the grandparents, but even the parents that need to be educated.
Yes. So, one of my daughter's friends had strokes when she was
Oh
a
no.
teenager.
Oh
So,
no.
yes. So it can be anyone. All right. Okay. So twofold. To basically take the information home to the family so that they're more receptive to, oh, what did we learn today?
Yes.
Also because it's fun, because it's exciting, people are going to remember it. And then also that the child then may need to be the one who takes the action. If we see, okay,
Yes.
what are we going to do? Something, granny is not right, mommy's not right, my aunt's not right. What's happening here? And to be able to phone the emergency number of 112.
Yes. And a lot of people might not be aware, but if you phone 112, it takes you to your cell phone service provider call center. And then from there, they will relay the phone call either to a government ambulance services or to the private ambulance services. And that's why we've taken upon ourselves to also reach out to the call centers to educate those staff about stroke and fast hero so that when the call comes in, they don't think it's just the child doing a prank. And because unfortunately, that is a burden on the call centers of getting a lot of prank calls, but that they also realize that it might be from what the child is trying to say to me that this is a stroke or an emergency. I have to pay attention to what the child is trying to say.
Yes. And then I was also thinking as well to all of you out there to make sure that your child can use your cell phone.
Yes.
Um, of course,
And
children can use
also
cell phones
teach.
in a heartbeat,
Yes.
but
Yeah, they know exactly what to do with the cell phones, but it's very
yes,
important to show them that how to get to the 112 number, even if your phone is locked. Some people might not be aware that you can dial the emergency number when a phone is locked. So you don't need to know the person's passcode in order to phone
yes.
the emergency number.
Okay, so that's interesting to know. So, in other words, you don't have to use the patient's face or the patient's finger or the patient's code to open the phone to be able to dial 112. You can
Yes.
literally just pick it up and dial 112.
And dial 112, yes. So you don't have to have the code in order to unlock it. If you have the phone, it says there at the bottom emergency call. You can click on the 112 and then dial the
Yeah,
number
I'm looking
without
at my
having
phone now.
to
Yeah,
unlock it, yes. If they are not sure, they can also have a look at our Facebook page. We've done some videos on this matter last year on both the Apple and the Android phone at Fast Hero Southern Africa on Facebook and Instagram.
yes. Yeah, and okay, obviously children are way more capable of us at opening a cell phone and using it.
Yes.
We still go, but where is that where? And they've like used it immediately. So I was thinking it's one aspect we don't really need to teach, but also, work through it with your children, obviously without actually phoning the number. But to
Yes.
see, okay, where is 112? How do we dial it? And I mean, even as an adult, I'm sitting here going, okay, where's the emergency? Um, yeah. So
Yes.
this is good to know.
Yes.
Okay. And it's also good that you've said as well, like that the person answering the phone is not going to think, oh, well, this is a prank, this is whatever.
Yeah, no, definitely. Unfortunately, it's something that they do. They are very cautious that children don't, make misuse of dialing the number,
Yes,
and that's what we urge when the teachers are working with the children in the implementation of the program to emphasize that to the children that it's only when somebody's having a serious emergency that that number is used.
yes. Okay, so it's break time again. When we come back, we're going to hear about schools. How do they get in contact? What are you looking for? But let's go for a break. Welcome back. You are tuned into Healthcare Hour with Colleen Qvist. My guest today is Renathe van der Merwe, and we're hearing all about stroke. We're hearing all about Fast Heroes, and Fast Heroes is an amazing initiative which reaches out to schools, and it is teaching children how to be aware of the stroke symptoms, of what's going on. There might be a problem. So we're wanting children to go home to teach families, and we're also wanting children to be empowered to take action if there is somebody having a stroke. Okay,
Definitely.
I summed it up well. All
Very
right.
well.
And then, of course, there is Frank, Armando, Sophia, and there's Tanya and Timmy.
Yes.
And they are these cute little characters. And they are here to tell us a story all about the face, the arm, the speech, and the time. Because in stroke, your face can be lopsided, part of your face disappears, okay, or like droops down. The same with your arms. Instead of having two strong arms that you can hold out, one of them will fall down a bit. And then also your speech. You may not speak properly, or you may not be able to speak at all. And then, of course, time is of the essence. You need to be able to be fast.
Yes, yes.
Okay. So now, how does this program work for schools?
So if there is a teacher listening or somebody that is has contact with a primary school, if a school is interested in rolling out, they could make contact with me or they could go to the website and register their school and their class. So it's www.fastheroes.com. So they will fill in their address and their information and I will get a notification. Say, for example, in a school, it doesn't need to be the whole of the foundation phase. So even if there's just one class in a school that wants to do it, they are most welcome to roll out this program. I just want to say that there's no cost involved in doing this program. It's absolutely for free. And I think in a society where resources are sometimes very scarce, knowing about a program that's offering resources for free is quite special and we want to urge the schools to make use of that. So say, for example, they've done their registration or they've reached out to me, I will set up a time either online or face-to-face and do an 1 hour teacher training session. So I will explain to them exactly how Fast Heroes work, and then they continue with the program over 5 weeks in their classroom. But if there's a teacher listening, she's already rolling her eyes thinking, oh, but I don't have 5 weeks to do this. It doesn't take more than 45 minutes per week. And she can divide it up into small bits as she has time after one lesson and there's a child that can continue with the coloring in page or so. Then she can split up the time throughout the week. So in the first week, it's an introduction of the characters, the Frank, Armando, Sophia, and Timmy. The second week, we just focus on Frank and his face that's drooping. So all the activities have got Frank in there. The third week is Armando. Week 4, Sophia, and week 5 is almost like a summary of what we have learned about the signs and symptoms and the 112 number. They practice the 112 number on a cardboard phone, and they each then at the end of the 5 weeks get a membership card that says that Colleen is now a fast hero that they can put in their wallet or in their purse. There's each child gets a workbook with all these activities in there for free, and each teacher has a set of posters in a classroom, and she also has access to the online videos and content. So that registration on the website ensures that she's got the online content at hand, and that's really designed so that she does not have to do any preparation or anything. It's not supposed to be a burden on her to roll this out. It's supposed to be fun and easy. And I really want to say that there's nothing better than hearing afterwards that children and teachers have had such a blast rolling this out. I have teachers that now are doing this as an annual project because they see the value, because the children love it so much, and because they see that it's important, that it really can make a difference.
Yes, and yeah, so I mean, amazing that all this information, the pack, the book, the little card, is all given for free.
Yes.
Okay. So clearly this program is sponsored by someone.
Yes.
Who
we
sponsors
function
the program?
we function as almost like the same model as a non-profit. So Fast Heroes fall under the wing internationally of Boehringer Ingelheim, the pharmaceutical company, but we function completely separate from the pharma company as a non-profit. Yes.
Yes. Okay, so I believe we need to recognize the heroes in the story, and saying, yeah, yay to Boehringer for sponsoring such an amazing initiative.
Yes. Yes. We are very thankful towards them.
Okay. All right. So we've said, if you contact Renate on www.fastheroes.com, you can register your school. You can say, hey, we need, and then you will do an online or an in-person
Yes.
training for teachers, which is an hour.
What really works very well is I also love to collaborate with a hospital in that school's vicinity, because we've realized also that teachers are very poor in taking care of themselves. And because we know that the risk factors are such a problem in increasing your risk for having a stroke, people don't go to the GP just because they want to check their blood pressure or want to check their
Yeah.
glucose levels. So when I collaborate with the hospitals in that area, we take a team through to that training. And while I'm busy with the training session, they have the opportunity to go to the nurse and get their blood pressure measured and get their glucose measured, almost as a thank you and a give back to the teachers as well, because we know that they also work in a high stressed environment and that they also need to take better care of themselves.
Yes, so they're a reminder to teachers to self-care that
Yes,
basically you cannot pour from an empty cup. You also cannot pour from a body
yes.
that's saying, okay, I need sleep, I've got high blood pressure, my sugar has spiked. Um, and so it's a reminder also for all our teachers to look after themselves.
Absolutely. And maybe that should be like a New Year's resolution for everybody to take better care of themselves this year.
Yes. Okay. All right. So thank you very much. Renata, what other information is there that we may need to know?
If they are not able to reach on the website, they are most welcome to pop me a WhatsApp on 082 523 5487. So it's 082 523 5487. They can contact me on there and then I can get the ball rolling, even if they just need more information. The videos, examples of the videos can also be found on YouTube. So if you go to the channel, We Are the Fast Heroes, you can see the songs that are sung every week and the videos that are used on the online material. And then obviously Facebook, Instagram, and we've also launched on TikTok and LinkedIn quite recently.
Yes. TikTok. Got to get the kids.
Yes.
Okay. All right. Okay. So reminder as well, whether you are in a center, whether you live in Joburg, Pretoria, Cape Town, Bloemfontein, or you live in Pofadder or Blikkiesfontein, you are able to reach. Yes.
Absolutely, absolutely. Any school. We also cover Namibia, but that is run as a separate project in terms of working with the Department of Education in the Khomas region. So we will do a project for Namibia again. And with Botswana, we are also covering Botswana, but at the moment we are just trying to sort out the national emergency number because they are not using one allocated 112 as an emergency number. So we are just trying to fine tune that before we are able to roll out in Botswana. But if in the borders of South Africa, any school, primary school or pre-primary school that is interested, that falls in that age category, is most welcome to give us a shout.
Okay. So thank you. Thank you for joining us.
Thank you very much for the opportunity, and I hope everybody has got a wonderful 2026.
Thank you. All right, so you've been listening to Healthcare Hour with Colleen Qvist. As you know, every week I'd remind you that you are loved, you matter, and you're not alone. And we'll see you next week.